Starting with a topic on Six Sigma Green Belt. We'll learn some more concepts in Six Sigma. Okay? Yeah, so few people are there today. Payal, Vinny, Snigdha, Rahel, Pratima, Geeta, Mayuri, Dipti, Binya, Bindu, Ashwati, Soumya. Good evening to all of you. Okay. Yeah, so lean management. You all know, right? You know, certificate, you will get it as Six Sigma Green Belt. Lean Six Sigma. Lean means, when you talk about the word lean, a person is lean. She is so lean. Lean means thin. Okay, so that means you will make the process in such a way that there is nothing that is wrong. Error free. Avoid wastage. That is a word. Okay. So, as more and more hospitals and healthcare institutions emphasize the importance of quality care and waste reduction in healthcare, Six Sigma methodology is becoming an increasingly popular concept in this field. Okay. So most of the hospitals are not utilizing the Six Sigma concept. So, however, some hospitals have already started to apply Six Sigma concepts and they have brought in a lot of profits in the organization. Okay. Six Sigma, how it's happening now, you see in the next 2 to 3 years, they will ask people, do you have Six Sigma? Then you come for this job. That much in demand Six Sigma is going to be. Okay. Now, so Six Sigma, it's a management tool. Now you will wonder, what is this Six Sigma? How do I apply it? What is it? It helps in increasing process capability and efficiency. It reduces the likelihood of error and waste. No error, no waste. We can't have complete error proof, but definitely there will be an improvement in the process. Okay. So, take for example, a shop. Let's look at a medical shop where you go for pharmacy, where you go for buying medicines and all. The moment you tell them that you need, there are few shops wherein you just have to tell them this tablet and the person is able to get it for you. Correct? And just imagine you remove that person out and you are kept in that shop and I tell you, I need chlorpheniramine maleate or Evil. You would go mad. You will go and search everywhere. You will not be able to find out which drug is there. Right or wrong? If I place you instead of that person in the medical store, and if I ask you for some drugs, you will not be able to find out where what is kept, right? So, yeah. So that's the thing. In some medical stores, they get it very easily. Some places, it may be new people. They're not trained well. They get confused. They are searching. Okay. So what's the concept? How do they do it? Most of the medical stores, they have a very systematic way of keeping things, like alphabetic order. The drugs are placed. So they know from A to Z where what is kept. Okay. They're given exclusive, exhaustive training on that. Second thing, first in, first out. Whatever is a later drug, when you buy a new one, you'll put that below and the lower ones will be kept up so that there's no expiry. Expiry check is mandatory for them, just like how we have in our hospitals. Okay. Now, when you apply Six Sigma in such a shop, what it means, more cubicles. Okay. Just imagine if you have a single box or a single cupboard and all the drugs are just kept labeling, versus you have cubicles for each alphabet. Which would be better? Come on, tell me. Which would be more easier and better? No matter however you arrange it in a single box, it's going to be messy after some time. But if you have each alphabet ke liye single box, that will be really better, right? You would have more room, more space for newer drugs, more understanding. Yes, with alphabet, single cubicles, if you have for each, that will be more easier. Okay. So most of the pharmacy shops have applied Six Sigma correctly. Okay. That's the reason why they have all the drugs of the world and still. And another concept. Have you seen that they note down the drugs that whenever you come to buy a medicine, they will note down certain drugs? Do you know why? They have an approximate count and an understanding that these are my requirements. Just imagine they'll be so confused which drugs to buy, which not to buy. Are my people buying this? Understanding. So depending on the need, they will buy it. Okay. All these things are a part of Six Sigma. They are trying to smooth, may simplify the process in such a way. Yeah, it is according to the doctor advice, definitely. But how will the shopkeeper know? Shopkeeper has to have an idea in 1 month. These are the most common drugs. These are the drugs which are used minimally. These are some of the drugs which I should always keep in my stock. And before expiry, I have to send it back. So they have a big headache, actually. If you'll stay for 2 to 3 days in a pharmacy department, then you will understand how they go accordingly. Okay. So this is applying Six Sigma. So how you can apply Six Sigma in this pharmacy shop is making it into cubicles, labeling it correctly. Okay. Then keeping a note of the most commonly bought drugs so that they have a hand of that and they know which ones to indent further. Okay. There are some pharmacies which have started newly. They don't have many drugs. They just have the most common drugs, and whichever person comes, they tell him, you tell me which drug you want, you will get it in within by evening. So what happens is they're trying to avoid wastage in the initial few days of setting up of their pharmacy. So when the people give order in the morning, they try to indent that for the evening. And later, after 1 or 2 months, then they can get it in bulk as per the requirement. Here, what's happening? You're avoiding wastage. Okay. Systematic methods utilized to avoid wastage by improving the process is actually this Six Sigma management tool. Okay. It increases the process capability and efficiency. It reduces the likelihood of error and waste. If a drug is given, if a name is given, if it is look-alike, sound-alike, it will not be kept together. Why? There's a possibility of giving a wrong drug. So that's why look-alike, sound-alike drugs will be kept separately. Even in the hospitals, that's the same thing. Okay. Now, what are some of the benefits of Six Sigma? Reduction of cost, increase in productivity, reduction of scrap rate. Scrap rate is you're just throwing out because it's expired or something like that. Reduction in delivery time. When a person comes, you give it immediately. Okay. Reduction of cycle time, reduction in customer complaints, reduce need for inspection and checking, increase in profitability, increase customer satisfaction, reduction in process variability, improved sales. These are some of the benefits of Six Sigma. When you compare this to the hospital setting, reduction of cost. See, when you have system and everything in place, you don't need to charge too much to the patient. Everything is systematic. There's no wastage. Then increase productivity. So things go smoothly. Everything is in place. You don't have to waste money. There's no wastage. Delivery time. So patient does not have to wait for a long time. They know their admission time. Within 15 minutes, they will be in their cubicle. All that admission process is in place. The process is there. There's one dedicated person who only looks after admission. So he doesn't have to. If one person is handling admission and discharge, he'll go crazy. So you have to give dedicated person for dedicated work. Okay. Reduction in customer complaints. So all these things. What is Lean Six Sigma? Lean plus Six Sigma is equal to Lean Six Sigma. Lean means what? Reduce the waste by streamlining the process. Six Sigma means reducing the defects. Okay. That is also very important. Okay, just imagine in the same example of the pharmacy shop that I told you, usme 5-6 doors are not opening and closing properly. It's almost in a very pathetic situation. So whenever you are opening the door, it comes down, then you have to again fix it. Is it irritating? You don't want to work on that door because for you, the most important, my customers coming, I need to give the medicines. So every time you open the door, you close it. Sometimes it falls down. Again, you'll keep the door. How much time do you waste in a day for this? If you calculate, it will be more than an hour because every time you are opening, it's closing, opening, closing. So what you have to do when you apply Six Sigma, this is called this is the defect. Okay, you have to reduce this defect. What is the only option remaining? What can you do? Call the carpenter and fix the door properly. It will take some time. Maybe half day you will have to keep your shop half closed. But after that you are free. But we don't want to do this repair. We just want to work till we can manage, till the last day. And once it's completely spoiled, then we have to go for a shutdown. Am I right? If you have a laptop or a mobile, okay, the initial 1-2 years, the battery was very good. Third year now, the battery started draining faster. Said, oh, I can manage this. I will manage. At last, then you will buy a new phone. Actually, better than that is when it's almost in good condition, sell it off and buy another one. So Deepthi has bought a new mobile or you are having your old mobile? So that's the thing. Don't wait till the end. Okay, repair it. Same goes with our air condition at home. Old one only, very good, Deepthi. So air condition at home. First, the cooling may not be that good. So what we'll do? Shall 24, 23, 22, reduce the temperature. Continue. At one fine day, after keeping it 16 also, there's no cooling. Then you'll call the mechanic. Then he'll say, wo aapka ye kharab ho gaya, compressor hai, gas change hai, gas leak, this, that. And then you will have to spend more amount. What you would have to spend just around 1,000 or 2,000 for maintenance, you would have to land up spending around 6 to 8,000. So when you realize there is a defect, rectify it immediately. That is the right method for Six Sigma. Understood? Wherever you understand this concept, you will be able to gain profits wherever you work. So if you are a nurse or a doctor or a physiotherapist or a clinical person or a non-clinical, you're working in a hospital, you feel somewhere you're becoming really tired fast or you're getting more stressed out. Find out why like this. Is there some other better way that I can do these things? If not, I'll have to take help. Don't put everything onto your head. Is the process right? Somewhere something is wrong. You have to have an introspection on that. So lean, that is either you have to reduce waste also and you have to reduce the defect. That becomes your lean Six Sigma. Benefits of Six Sigma: reduces operational cost, improve efficiency, improve accuracy, improve customer service, improve the cash flow, improve regulatory compliance. Lean Six Sigma in healthcare combines the strategies of Lean and Six Sigma methodologies. Okay. Waste handling, while Six Sigma is known for process improvement. So, two things are there. One is handling of waste and one is Six Sigma process. And when you combine all this, you get perfect Six Sigma. Now, look at the levels, which is there on the screen. Can you all see the levels? White belt, yellow belt, green belt, black belt, master black belt, and champion. So, white belt, yellow belt, you can check online. You will just get it free of cost. Maybe, yeah, I'm not sure. Just search for free white belt, Six Sigma or something. So, what you all are doing is a Six Sigma green belt and some of you are doing black belt. So, green belt means you have knowledge and tools to save around 30 lakhs in a year. So suppose you are working in the nursing department, okay? And in a year, you are the top management. So you are the nursing head, team manager, matron, assistant matron. You can save around 30 lakhs in a year. Maybe by reducing the number of staffs that you need. If you have efficient staff, you don't need too many headcount. With one person, you can manage everything. So you will do that. You will train them in such a way that they will be more efficient. Okay. Just to give you a simple example. Okay. Before Six Sigma, you are managing your house. You had one maid to wash clothes, one maid to cook food, one maid for sweeping and swabbing. Okay. Finally, you thought that you're paying too much. So you found out one maid who would do both sweeping and swabbing and washing clothes, and one for cooking. Gradually, what you will search for? You will start praying, Lord, I want one maid who can do all these things. Right? And finally, one maid who does everything. You found out that person. In that person, you will charge as per one person's salary. That person is also happy because he got 2 to 3 roles, and you're also happy because you have saved some money, right? So that is applying Six Sigma to avoid wastage. You don't need too many people. Each person you'll have to pay minimum fare. Okay, you'll have to pay 2 plus 2,000. Just an rough figure I'm giving you. 3,000, 3,000, 3,000 for each maid. If you are paying, it costs 9,000. Probably with 6,000, you will be able to manage one single person with all this work, right? Because that single person may not get so much of work in any other house the way she gets it at your place. Now you understood the concept. Now what management does, sometimes they will recruit one person. Like suppose it's an HR, they will recruit one senior and one junior. Junior may be having less salary, senior more salary, rather than putting two juniors, because that senior will manage everything and the junior can follow the commands. In a nursing department, if there is one MSc nurse or a BSc nurse with good experience, they'll try to put that person to in the education team also and in the infection control. So both. So in both ways, both are happy. The nurse is happy because she is getting dual role to play, and the management is happy because you can give her better salary than either an infection control nurse or an educator. So both are happy. Now you got it. This is how you try to improvise your process and efficiency. So green belt, you can save up to 30 lakhs in a year. Black belt around 60 lakhs in a year. Master black belt above 1 crore. So project leaders, project managers, they undergo these kind of trainings. Now, we were talking about lean management. I want to reduce waste, but I have to know na, what is the waste in my hospital. Correct? See, like how you can see in this circle, people waste is there, quantity and quality. Okay. Now, in people, what is there? Over processing, motion, and waiting. Okay. People. So, some in our CSSD department, you have kept 4 or 5 people because ICU people every day they are indenting gowns, gown packs, CSSD tray, gauze piece. They are not bothered. I don't want to fall short of the gauze piece and gowns. So they just keep on indenting every day 7 to 8. And actually they are using only 4 or 5. Okay. What happens to the rest? Come on, tell me. What happens to the rest? What happens to the rest? Correct. The remaining one will get expired. What is happening then? Again, you will send that to the things. They yes, all get collected, and then you will send all that because it's expired. So you're feeling like your department, you're doing a good job. I don't want any expiry in my department. I don't want anything in excess. So you will order, you will intend. So whenever doctor comes, you have excess of gowns. You will go on giving, and those who don't, whatever is expired, send it again for CSSD. But what is happening in CSSD? CSSD is over processing, unnecessary, which is not required. But does CSSD know that you are doing this? No, because CSSD may be in second floor, you are in fourth floor. CSSD only knows one thing, that the sister in charge of ICU needs almost 10 gowns daily, and he will process it according to that. So you see how we are wasting resources. So instead of 10, it was 5. In the same way, each department is doing the same thing. Almost 50 to 100 pieces you are over processing on a daily basis, which is actually a waste. Now you understood one of the waste in healthcare. Next is motion. Motion means too much of walking. That means you have collected a lab sample. You are going here, there, going there, collecting the reports, taking on the phone. Everything is too much of walking. Then you call the housekeeping. Housekeeping takes at 10 o'clock, everybody samples, go to the lab, give the sample, then come back. By the time after 1 hour, again, now you have to get the results. Again, you will go collect their results. This is motion waste. What? So now what hospitals have started doing? There is shoot system. You don't have to send samples to the lab. Directly keep it in the chute, it will go. How many of your hospitals are having chute system for uh, lab, pathology? How many of your hospitals are having chute system? Wherein you just have to keep it in the chute, it will go to the pathology department. Anybody? Government hospitals may not have started. Okay, Mayuri has. Mayuri is in Narayana, no? Yes. Okay. So that is how people start. Columbia Asia also has. Very good. Correct. Then where else? Manipal Bangalore has. Okay. So many of the hospitals have started doing that. This is to, so why now when you look at it, you will remember my class. Why? To avoid the motion waste. Too much of walking. So what, how have we saved? We have invested, they have invested money in that machine, but it's lifetime. The housekeeping whom you have to keep paying him a salary of 15-20,000 on a monthly basis, one person you can reduce now, because you have to dedicatedly keep one housekeeping, and they are never available, because once they go to do, they will roam around in other departments. Okay, so that problem is solved. Then collecting the reports on the phone, not required. If you have a proper HIS system in place, you will get the reports on system. You don't have to keep calling anybody, except if it's a very emergency situation where you can call and find out. Okay. Then is waiting time. Waiting time means everywhere waiting time. Even when you take interview for a nurse, waiting time is too long. If a patient comes for admission, waiting time is too long. Discharge, waiting time is too long. Everywhere waiting time. CT scan, MRI, because the hospital doesn't coordinate properly, they are waiting time. So this is all the people waste. Over processing, motion, and waiting time. Understood? Then comes about quantity. Making too much, moving things, inventory. Too much of inventory, just like the CSSD only, too much of RL, everything is in excess. So that also is a waste. Then quality, about quality, fixing defects. Defects. So ventilator is not working, still it's kept in the department. So when an emergency, a new nurse comes, a novice nurse comes, doctor told her to get the ventilator, she got this one. Then later on, they understood this machine is not working. It's such a waste of time. Then they again go back, then take another one. In the same way, same for BiPAP machine. Any of the machines or a laryngoscope, which is not working, it's kept. So not working things should be eliminated from your department. Okay. So now you understood the different. So we don't have only the red bin, black bin, white bin waste. That is biodegradable waste. This type of waste is called, handling this waste is called as lean management, where you reduce the waste. Okay. I hope this concept is clear to all of you. Clear? I'm completing your whole Six Sigma in one day, actually. Anyone has any doubts till now? Okay, it's clear. Very good. Now, let's move on to Six Sigma methodology. DMAIC, DMAC methodology, it's called. Define, measure, analyze, improve, and control. Define the process, measure it, analyze, improve, and control. Take an example of what is it? Bed sore. Let's take example of bed sore. Too many bed sores in the hospital. Now let's use Six Sigma methodology. Defining the problem, increase number of bed sores. Measure it. So in the last year it was less. So this year, how many percentage it has increased? January 4, February 2, March 5, like that. Okay. Analyze. Now which type? It is first degree, second degree, which department. Analyzing means what all you will analyze, which degree it is, which department is having more, which procedures are causing them, whether it is post surgery or pre surgery, is it outside bedside or in house. You will analyze. Okay. Then improve ke liye procedures are, protocol is kept in place, 2 hourly back care, turn position, change position, all that is there, but is it being followed? That is what you have to check. Then you will realize it is not followed. There is no change of position. Nothing is happening on a correct time. What can you do? Come on, now you all tell me the answer. Protocol is completely set in place. Okay, everything is set in place. The protocol is a world best protocol for your bed sore, but it is not being followed. So how can you solve it? Only then you can become a Six Sigma expert. Come on, you all tell me what can be done. Do your brainstorming now. This brainstorming is required when you're working in a hospital. Then only training. Okay. Training is very, 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 very important. Training and retraining. What else? Training, they will say, yes, ma'am, yes, ma'am, yes, ma'am. Okay. Again, we can't be assured. CCTV camera, to we can't keep. Workshop and training is all good. What else? Some practical thing that we can do. Post test. This is all your evaluation of the training. Okay. Now I'll give you one example. So what I will do if I was working as a head of the hospital, I will appoint Vinny and Binia as my thrombophlebitis handing taking over. Yes, that is very important. Snigdha is good. Yes, but one practical thing that I'll do is I will keep Binia and Vinny as my thrombophlebitis audit nurse. Okay. For 1 month, I'm not going to give them any other work. What work I'm going to give them? Go on taking audits everywhere to ensure that people are following this. And this is the first step in Six Sigma. If you have position changing too early is very good. That is there in the protocol. Hello. Yeah, I got a call. Now, can you all hear? Am I audible to all? Yeah. Wait. Yeah. So I'll appoint Vinaya and Vinny to go through the person, go personally to each department and do an audit